Good morning. Welcome. Thank you very much for your time. We've got an awful lot to cover today. Excuse me. Dudley's going to do a piece on equality, diversity and inclusion, which is a hot topic as far as the media are concerned, and it's very important. And we've got John Buttle with us from Social Works, who will do a presentation, which is great news around training funding. There's more funding available than there was, but it's going to be pretty much a first come, first served, but John will give you the details. Whilst the summer period has been carrying on and we haven't had a meeting, we have circulated a lot of information. A lot of things have happened, some of which are not great news, some of which are good news. We're not going to go through them in great detail, but I will try and give you an overview. I've put a lot of it on the website. If you have questions, do please contact us. We aren't qualified to give legal or financial opinions, but we can probably point you in the direction of people that can. As Dudley mentioned, we meet with either directly or through the Care Association Alliance, CQC, local authorities and other bodies on a regular basis. So if you ask questions, we can often pass them on. The problem is, particularly in the case of CQC, a couple of providers asked questions which were passed on, but it has taken several months to not get a response. So it isn't that we've ignored them or forgotten them. It's simply that we have not got the response, so we can't pass that response on. I am actually going for the annual face-to-face meeting with CQC next week. And that's partly on behalf of LCaS and partly on behalf of the national body, the Care Association Alliance. There are a lot of problems at CQC, as you're aware. The portal still doesn't work properly. Inspections are not great because they are only at the moment doing around 13 quality standards per inspection, which is basically not enough to amend a rating. So not good enough to move you from RI to good, although strange enough, it does seem to be good enough to alter you from good to RI. And there's also some changes afoot in the way that things are being done. And as we learn more of those, we will let you know. I'm not going to dwell on MPOCs. There is a review underway. There is guidance coming out. We have put what we know on the website. I'll give you a link in the chat. And then you can go from there. As I say, if you've got any questions, you want any more information, contact either Dudley or myself, and we will give you what we know. And as we find out more, then we will put that on the website. We'll circulate it through WhatsApp, and there'll be a newsletter coming out in a couple of days. If you aren't getting stuff, either one way or another, let us know. Sometimes because we use bulk mailing, it does go into junk. So check your junk or spam, and we'll just see what we can do. Dudley and I are doing some work in southeast London and north central London, and that's on international recruitment. If you are based in any of the southeast or the north central London boroughs and you want to be part of that, then again, contact us. We will be circulating information very shortly, and those processes will be starting in September and October. There's 2 or 3 things that you need to be aware of. Digital working and adult social care guidance has been updated. Dudley knows considerably more about that than I do. And if you want updates, again, do question. There is some money available, and Dudley knows a number of people that can help you access that. Have any of you dom care providers been approached by the government department, the whatever it is, the EAS, the Employee Agency Service? Anybody been approached? Okay. What they are saying is that as domiciliary care agencies, you are liable to be inspected by the Employment Agency Service. There's something of a interdepartmental dispute going on as to whether this is right or wrong, but we are aware that some dom care agencies have been visited by and inspected by the EAS. Now, again, we're trying to find out exactly what is going on. It seems to depend on whether you have private clients or whether they're all funded clients. If you have private clients, you are more likely to be subject to an inspection. If you are operating with self-employed carers, then you're very likely to be inspected. In a way, it's easier if you are operating as an employment agency because you don't need to be CQC registered. So it's a lot of saving. But you can't, of course, offer personal care services if you are. But as I say, it's a confused area. Even within the EAS, there has been a dispute as to whether they should be checking DCAs or not. If you do get an inspection or hear anything, please let us know. We're trying to find out what's what, and we'll spread the information when it comes along. There's one or two things coming through, care workforce pathways, etc. We will put information on that. And if you're involved in learning disability, Oliver McGowan training is a hot topic. It is very difficult to access that at the moment, and it's expensive. Again, not going to dwell on it. If you've got questions, please contact me. If you've been subject to a CQC inspection where they have raised the subject of Oliver McGowan training, please let me know. And it's going to be discussed at CQC next week. Whether we get an answer at that point, we don't know. We do know people that put the basics for the Oliver McGowan training together, and they are looking to get some changes very shortly. Again, something else that you ought to be looking at, the Better Hiring Toolkit. Again, we've circulated that. We can get you more information. It ticks boxes with local authority and CQC inspections. And top of everyone's hit list, HMRC. HMRC are focusing on social care with regard to particularly dom care agencies, with regard to lack of scrutiny and exploitation of staff not being paid the right overall pay. A lot of that is around travel time and waiting time. And HMRC are linking with the Gangmasters, GLAA. They also link with the Home Office and UKVI. So as a triumvirate, they can cause you quite a lot of time wasting. And if you haven't got your ducks in a row with payment of staff, HMRC are very difficult to deal with. And as Dudley will tell you later on, I'm sure, the same applies for Home Office, COS licenses, etc. They are very rigid in the way that they inspect. There is no grey area. It's either right or it's wrong. So again, if you want advice, we can give you a bit of advice, but do contact us. And last but by no means least, death certificates. There were some changes on as of September the 9th. Again, there seems to have been a bit of confusion around that. I think it's down to interpretation, primarily seemingly from primary care. If you get any queries, we've put the information there. There is some guideline, or our guidelines rather. Again, we can circulate those again. do let us know if you've got any queries, because we will take them up with CQC, because they're the ones that put out the wording. Dudley, I'll hand over to you now. Thank you.
Thanks, Peter. And everyone, you can appreciate, whilst people said August, and people sometimes say in other professions to have the summer off, we've been extremely busy. And as you can see, waiting for what developments have happened from the government and to be passed down. And we've been drip feed bit by bit. But as you can see, openly and honestly, nothing much seems like it's going to change with the government presently, and in fact it may get worse, as the Prime Minister says, before it gets better. Outside of that, day-to-day things are happening. Peter's mentioned, and we've got John Buttle speaking later about training and accessing funding for training is important. I also will say as well, and I get lots of calls because we do lots of work and try and advise providers as well, that you are running a business as well. So front of all the wonderful care work that you do, it's about actually your compliance being well led, how you manage your business, but also as well as any business, it's not just about managing the business. How do you attract your business? I've been to various events now, and a lot is talking about the PR of business. And that means how you advertise your business, attract people to come to your service. It's looking at things such as website, your online presence, and basically networking in the room. We all have busy jobs, and sometimes the saying, it's who you know, it's not what you know, also plays a big part. So where you can, try and network in various events. There is the Care Show that's taking place, I know it's in Birmingham, on the 9th and 10th of October. But if you can, try and see if you can get down there. There's lots of exhibitors going to be there on the day, where you get to interact and speak to various people. So also as well, do look into things like that. Choose, because over the calendar of a year, where you can actually go to various events, it's very helpful, and do maximize on that. I know lots of people have put messages in the group. People will be sharing information around our contact details. We have a WhatsApp group where we try and put as much information as possible. We try and make it as regional as possible, but also as well, we also have those from outside region, because as LCaS is, it almost seems to be a great source of information, and lots of providers seem to be actually accessing that. So please do share, but also as well, it's also good that you can interact in the groups, and actually there may be questions that you can pose in the group. So I've had that, what's the etiquette of the WhatsApp group? The WhatsApp group, you can ask a question kindly. Some individuals may respond, so please do see if you can respond. If there is any information that you can share, then potentially you may be able to take it offline or privately as well. So these are some of the things that I will share. And later on, we're just going to speak a bit further on about LCaS going forward, because there is a lot to digest and go forward. So apart from that, Peter, I don't know if you want me to move on to me sharing and starting off. So whenever you're ready.
Please do, Dudley.
Okay.
I'll put a few things in the chat, but again, if anybody wants any information, let us know.
Okay, I hope that it works for me, because sharing, hopefully, if it's the right screen, if you can see the right screen. I'm not sure if you can see a full screen, or what can you see, Peter? Let me, okay, no problem. Can you see the full screen now? No problem. Well, thank you very much, everyone. And I know I've transitioned from being the chair of LCaS to also share a lot of the work that I get to do as well off LCaS, my day-to-day roles. As my role, I wear a few hats, and one of them is co-chair for Skills for Care's Race and Equity Reference Group. So I do a lot of work trying to support those from various different cultures, protected characteristics as a whole. And one of the things is that this area has grown and is in growing even more. It's one thing that connects us, not just for just as social care, but as the country as a whole, and it's also now impacting with CQC are looking at it. So, and I get to speak not just in this sector, but outside the sector as well. So today I'm just going to be presenting very quickly, as quick as I can, on the area of EDI. And for those who are not aware, it's equity, diversity, inclusion, health and social care. And this year alone, I've trained over 600 staff members in regard to this area. And it seems something that is important. So people may not understand why EDI is so important, but I will start by just sharing. And one of the things is when we meet individuals, and we have so many individuals across the sector, and we are such a diverse sector, it's actually, we meet people, it's getting our names right. And one of the names is one of the most important things when we start. As you can see here, I've got a slide here which breaks down my name phonetically, and there's an app there which allows you not just to, because there's so many names, to actually pronounce it right. And so broken down, it actually phonetically gives you a chance so people can pronounce your name correctly. One thing I found, which is quite interesting, is that as much as we have lots of international workforce that have come into the sector, the struggle is that sometimes they struggle with basic English names as well. So some of the time I'm known as and called Doodley, so I do try and correct them as well. You can also see as well on the side there, not just my name being phonetically broken down, but also as well, you can see that there's pronouns by my name as well. And for some, it may not mean anything, but it also gives an indication. Now you'll see with these next to individuals' names and what it means as well. So he and him just means that I'm like to be addressed as he or him and be deemed as a male. That's, people have different pronouns. For females, they may be known as her or she. And for those who do not identify as maybe male or female, they were known as they and them. So these things you may see. So it's just making you aware. And one of the most important things why I address this is because now in this present day and age, it's important to understand how people like to be addressed and connected with. So there was a study that was done, and it says that why the names are important. 73% of people have had their names mispronounced. Regardless of the reason, it can be hurtful. And after all, your name is more important than just name. It can be part of your heritage, identity, and pride. And I always say, if you get someone's name wrong, it's not just as your staff, but also as well for your service users or your clients, then it can be the beginning or the of not of a wonderful relationship. So we want people to have a wonderful relationship. We know lots of members of staff come in, and actually, if you had these names broken down, it would be very helpful pronouncing and getting names right and correct. So why EDI is so important now, where EDI is at the core of great people management. EDI is not just it's not just an organizational issue, but it's also becoming even more important, increasingly complex as we encounter conflict and different views. We have a very eclectic mix of staff members in health and social care. Inclusion and equality have long been part of protected characteristics for the people we care for. So are we supporting health and social care staff, which provides one of the large diverse workforces in the UK? We see a lot of information with the NHS, and they're very vocal about it, but we don't really have a lot of that platform when we come to social care. And there's a lot of information I hear and spoken to about. I try my best to sort of share best practice as well. So actually providing training that helps a lot of staff, not just those that are homegrown, but also those who are coming into the UK, it seems to be even more important. And remember, everyone, as we speak, there is no I in team. So a more inclusive workforce means a better representation, but also benefits the sector with retention and recruitment. UK health and social care providers also have a legal obligation to address inclusion, discrimination, equality, and policy and services. So as you can see here, to have a more better retention, it seems to be the more inclusive your work environment is, the likelihood that people are staying. And then the studies and the workplaces I've been in, actually those who have stayed longer have found that they're more inclusive with their organization. But also as well, from a legal point of view, it's also one to understand now as employers and providers, you have a legal obligation to address any areas around that. And I'll touch on that later with CQC. So one of the things I always say, and it's something that I think everyone should understand, diversity is having a seat at the table. So that's the mix, a blend of your organization. inclusion is having a voice. So that means that you're not just having a vast, different, diverse workforce, but do they have a voice? Can they come and knock on your door? If they have issues, we know if mental health is becoming a big issue in their well-being, are they able to share their information? I say to everyone, working in social care isn't just about working the 9 to 5 or the shift. Also, when people go home, we all have problems and issues. We struggle. The pandemic showed around the well-being. We have talked about the care of living, the cost of care, so many things in there. So inclusion is also people having a voice, how they feel, but also as well, belonging is having that voice being heard as well. So it's not just listening to people, are we actually hearing them? Are we actually doing something about them? So the really importance of actually having a really diverse is more than just having a diverse sort of tick box. It's about being included and actually looking out for them. Is hugely important as we go forward when we look at that as well. Now, I show this picture when I do my training. This is an exercise that is involved, but it's to do with food. But beyond food, you can see social care is, especially in the sectors we're in, we come and we get people from all over the globe now coming in. We know the international workforce, we see such a diverse workforce. It's hugely important of those when they come into the workforce, how are we involving them? How are we incorporating? How are we looking at them? But beyond that as well, outside of that, it also works with the people we're caring for. Now in the UK, the actual change in makeup of the UK is completely different. If you look, especially in London, we know the makeup now of the actual different ethnic groups is hugely important. We know that the main area of when we talk about things such as, I think Peter, I think we should put this person on mute.
I presumed he wasn't
Yeah.
anyway.
Oh, okay, okay. This is
Peter, I'm not sure if you can actually let me.
I probably need to mute everybody.
move away from him.
Okay,
Okay.
no problem. Can you hear me now?
Yes, we can.
Okay.
Yes, we can hear
Yeah,
you,
he's-
Dudley.
Yeah.
I think he's been put on mute now.
I think you may need to unmute yourself, Dudley.
Thanks. Thanks. Sorry about that. But it's not just about actually the staff members. It's also about actually the residents, clients, service users. And there is a big area now known as culture appropriate care or cultural centered care, as I class it, is because if your staff are not aware of the culture of your actual clients or the people you care for, then the likelihood is that they may feel alienated. And there's been some cases now that have taken place and where families have taken actually not just providers to court or tribunals, but also local authorities about the type of care that's been received by their loved ones. So it's important to also understand that trying to be as culturally aware as possible is really important. It's really now deemed as something that you really have to have. And it also is really helpful because on the flip side, it also can attract different people to yourself. I do a lot of consultancy work and people ask me, how can we attract more people to our service? Or actually being more diverse and open to actually look at different cultures is a huge area. We're an aging population. If you think about those from the Windrush generation, a lot of that generation now, the people that we will be supporting in our care homes, but also there's others that have come into the country who also will need our support. So bear in mind of how diverse and inclusive your workplace is, not just for the workforce, but also for the individuals. But it's not just about thinking about the different countries you come from or your race or religion. One of the areas which seems to be hugely maybe not thought about and looked at is the notion around LGBTQIA+, and what does it mean? I'm not going to quiz everyone now about what it stands for. I'll leave that for another day. But a lot of individuals are not aware of what it stands for. It's not just overseas staff. What I found is those from maybe a different generation probably still can't relate. And there's a big area now of about 40, there was a piece of research that was done, which over 45% of LGBTQIA plus individuals felt that people didn't understand them in social care. And I think it's something which we have to address. But it's, as I said, it's a problem that just lies across everywhere when we think about what we're trying to do. So I think it's important to highly understand you shouldn't just be looking at race, you shouldn't be just looking at someone's actual religion, but also look at all elements. For me, as I speak, it's a lot about judgment. And so actually having a more inclusive workplace really helps regards to that. And you can see here briefly, keep calm, language and terminology matters. Yes, it does, because the language we speak and say plays a big part. People will tell you how they feel if you address them. We spoke about the names in the beginning, but we're talking about language. It can be abusive. Are we using our language in the right way? And this works both ways. If, for example, one of our clients is abusive, how can we help support our staff? But also as well, we can also help with addressing the language, how we incorporate it. It's hugely important to understand. So even if it means that you sit down as a group and say, this is the sort of language that's important, it's really helpful. So bear that in mind as well. As you can see here, a lot of individuals may have felt offended. This is just something that I've put together because sometimes, apart from going through to the tribunal, raising with your manager, of course, everyone should have a process if someone is discriminated against, but sometimes it's able to actually, how do we meet people at first hand in person? So things like that's not okay with me. I'm not comfortable with that. What you've just said is harmful. We don't say things like that here. Help me understand what you're thinking is a way sometimes where our colleagues may not understand things. So it's just also finding about that. So there is things where we know language is offensive. We also know that it's been addressed. It's how do we handle it before it escalates? Because we understand as well, we all live in an environment, we're all trying to share our cultures and understanding different things. But we also have to bear in mind that we also have to be as understanding of each other's cultures as best as possible. And where it leads to as well is that it follows up when we talk about EDI, and when I speak about it, it follows under all these areas of legal rights. The Equality Act is the main place, which not just covers social care, it covers the whole country. It covers all the characteristics that I'm not going to go into it right now, but also as well, it's how you act as well, your rights, human rights as well, which is still also the act there. It's important. The Mental Capacity Act as well is important as we incorporate into social care. The Care Act 2014, the Health and Social Care Act 2012 as well. All of these areas all work and realize the importance of EDI as well, and how it's addressed. So do bear in mind of why it's hugely important. Going further than that, CQC and the new assessment framework have really also just showed why it's important to understand about people with individuals, their culture, and where they're coming from. And the I and we statement, it says treating people as individuals. We expect providers and commissioners and systems leaders to live up to the statements. We treat people as individuals and make sure their care, support, and treatment meets their needs and preferences. We take account of their strength, abilities, aspirations, the words that you see, culture, and unique backgrounds and protected characteristics. CQC are actually looking to where we are actually incorporating it there as well. And you can see communication is a big thing. And it says here, staff treat people as individuals, considering any relevant protected equality characteristics. So understanding that first, before you can provide the person-centered care, is understanding where someone's coming from helps with that one. With the I statements, it's also touching on, I keep in touch and meet up with people who are important to me, including family, friends, and people who share my interests, identity, and culture. So actually sharing with those who you're caring for, supporting their culture, their types of food, maybe their music, people, or where they go to, it's important. Subtopics, personal, cultural, social, and religious needs are also important as well. So you can see it's not just us, but actually CQC are looking into it. And to go further, CQC are looking at further with the workforce and well-being, where they say that staff have easy access to personalized support that recognizes diversity of the workforce with protected reactive measures as well. They actually look now and are asking staff when they're doing inspections of how inclusive the workplace is, as well as just also as well the actual clients that you're caring for, the service users. So it's hugely important now of the new assessment framework, how it's incorporated into it. So showcasing this is hugely important. Remember, everyone, a lack of cultural competence creates a barrier to effective communication. These are missed opportunities to provide appropriate interventions tailored to the patient's health needs as well. So actually having that barrier is really important to try and remove the barrier. So understanding people's cultures is hugely important. And always everyone says to me, well, I don't know. It's about asking, maybe using staff in your workplace who can help, but really understanding about culture is hugely important. Just to add on culture and things that we can do, there's different things that happen throughout the year: Chinese New Year, Diwali, Pride Month. What's coming up next month is Black History Month, and the narratives, reclaiming narratives. It's a very good time to showcase you as a workplace of what you're doing to support those who may be from a black background or heritage. So this could be from staff, this could be from service users, clients, showcasing how you make, it's called reclaiming narratives. So sharing stories of historical stories of those who may have been in your workplace, where they've come from, the cultures. If anyone knows me, I love to do food events, and I famously ran a jollof rice cooking event in the whole across Southeast London, across social care and the NHS. So it's important that we can actually get to utilize this. I'll be doing a piece with Skills for Care, and there's also a survey that I'll be potentially sending around for any staff who feel they want to address whether or not their needs are being addressed by CQC, and if they feel left out in their workplace and environment. So it's important that we all share that. And just full circle what happened over the summer month. As you can see, that a carer's car was burnt during the Middlesbrough riots. I'm not sure if people understood this, but carers were targeted because of their religion and the color of their skin. And I was able to actually put together a contingency plan, which I shared with a lot of providers. I'm not sure if you did receive it. If not, please do put in the inbox if you'd like to get that contingency plan, because if anything like this happens again, it's showcasing that you are prepared and thinking about how you would navigate and support staff for their safety. It's hugely important to understand that human rights is hugely important for the workforce as a whole, but also the diverse workforce, which is hugely important. Rounding off, I think it's important when we see that everyone wants equality, but before we get to equality, it's also good that we get equity, because some people are at an advantage to others. So actually, our purple friend here requires 2 boxes. I say this to say is because we get lots of workers that come into our workforce, especially those who are overseas, understanding where they may need a little more extra support than others. So we can do that. So it doesn't mean everyone's just given the same type of support, which is important, but also some may need to be extra to that they all can see over the fence. Hugely important. You'll see that I really talk about inclusive workforces. You're going to see now signs like this now, where you're going to see this on toilets, where you've seen an inclusive toilet, meaning that it covers not just those who may be in a wheelchair or have a disability, but also those who are maybe male or female. And it shows that your workplace is looking to be as inclusive as possible, and we all feel welcome regards to that. So I know it's really a snapshot. I do run a training around that, which I've been doing, but also beyond that, I try my best to support those across the board. It's happened there, it's come across now with a lot of overseas workers as well. We're getting information where staff probably don't know where to turn to, also elements around abuse, and understand the culture on the needs of the workforce as well. So thank you very much for that. I know it's real whistle-stop short snaps talk on this, but it's just to get people be aware that it's not just a societal thing. It's not just a nice to have. Actually embedding this in your organization can help with retention. It also helps with those when it comes to your inspections, and also can be a source of providing, bringing and keeping those to your workforce and attracting new customers and clients. So thank you very much, everyone. And yes, thank you, Peter.
Brilliant. Thank you, Dudley. There was an awful lot of content there. There's clearly a lot of interest. We've had some questions. We will put all the slides and the recording on the website. If you want to talk to Dudley, that's no problem. If you put your email in the chat or your telephone number, then that will be passed on and Dudley will contact you. He only works 27 hours a day. So it is pretty busy at the moment, but rest assured, give us a few days and we will make sure that you are contacted. Any questions for Dudley that aren't in the chat? You could have stunned them all into silence, Dudley.
One thing I will say is that when I've done this training session, it's been bespoke to actually all sort of different providers, and it's been quite interesting, as I've said, in regards to the interaction of staff. So it's an interactive session of how it works, about 3 hours. A lot have been done face to face, but also it can be done virtually. But it's really intriguing how a lot of the individuals weren't sure and didn't know. And actually, it's a safe space. A lot of the time, the managers aren't there, but it's really upskilling the knowledge. So when they do leave there, I always talk about the value add for your staff. It's important in this busy day and age to actually be aware. And even if you have a basic policy of having things in place, I know a lot of you may do, but it can be embedded in your meetings, you know, and letting people share information as well. But yeah, I'm sure lots of people, I can see them talking about the actual contingency plan as well. So I think I'll reshare it with Peter, so people can actually access it as well, because I think it was very helpful of what to do in case of anything like riots or where your staff are feeling endangered on their day-to-day life as well. So thank you.
Ali has raised a very important point in the questions in chat, rather, which we've come across before and you've covered before. But let me just read that out. Thanks, Ali. We've had issues with clients saying they do not want carers who are of colour. This becomes very hard for us as a provider. How do you handle this?
I would like to sort of sum it up in one sense. I think you also have to remember as well, we're dealing with individuals. I know it's always a case of it's their age or generational, but I think we have to split into two sort of camps. You owe a duty of care to all your members of staff. I would say the easy option would be to really think about your staff and take them out of the, for example, situation or their role, so they're not in the line of fire. And then once you've dealt on that side, do your best as well in looking at different your clients or the people that you are taking care of. And you can take a stance in twofold. It can be a one where you actually speak to either the family or the individual and let them know that this is not acceptable, and then you have to consider whether or not you will be caring for them. I know people will say they're the finances and they're the clients, so maybe you just may need to send different members of staff, but then also say you provide training or address it to family members that this isn't the case and it shouldn't happen, and let them be aware. It's not very easy, in every situation maybe slightly different, but the most important thing is that your member of staff's well-being. We do not know the history of your member of staff, whether they've experienced discrimination in the past or not. So actually their well-being is the most important. Ask how they feel, what things you can do to support them, if they feel they're strong enough to continue to see the client or not. But more than likely, it'll be a case of just taking them out and actually supporting them going forward as well. I know it's a general answer, but as in every situation is slightly different, but it's not acceptable full stop for anyone, no matter their age, to say any language. And I think you can make a point, not to the point where it means that you have to, every situation is delicate, but understand making your point, meaning that in this day and age, we try to make sure that language, the way people address it slightly differently as well. So, but yeah, if anyone wants any questions or want to ask me anything on that, I will do my best to do and help you where is appropriate.
There's several things have popped up in the chat, and I'm just struggling to actually catch them. I mean, Joe has come up with a response to this. We've experienced this in the past. We tried our best, but had to go back to the local authority who visited them and told them that providers can only use who they have, and they were given any option to get a direct a DP to source their own carers. That is one route, and we do know that a lot of the local authorities are very hot on this, and we also have found out that sometimes this issue comes around and the client has had several providers and they've just been passed on and on and on, and nobody has actually dealt with the issue. So it's an important one.
I mean, I would one last point, Peter. One thing I would say, and this is not to scare anyone, there are now tribunals taking place around race, sex. So many discriminative cases are taking place. So be aware that this is actually taking place, but also as well, local authorities have been taken to tribunals as well as providers for not providing adequate support as well. So that's the scary part. I don't want to share the figures right now. I could tell you the large numbers of payouts, but also as well, have a policy in place, have a procedure if something happens, that people know what they can go through and who to turn to as well.
Thanks, Dudley. There are other points in the chat which I'd like to come back to. I need to roll back through that. If I can do that, we've got John Buttle with us, who's going to talk about funding, which is a fantastic opportunity for you. And John's got a huge amount of knowledge to impart, some very useful slides, again, which they will be on the website. So if I can hand over to John, and then I will go through and we'll come back to the points in the chat. Do you want me to put your slides up, John, or do you want your co-host so you can put them up yourself?
I'm quite happy to put them up myself.
There you go. Fantastic. Yeah. Thanks, John.
All right, let's bear with me for a minute. Yep, there we go. Hi and welcome everyone. I should point out before I go any further that this is still a bit of a work in progress, and there's quite a bit of history to the changes that have happened in funding. First off, it was announced back in April that there would be a new way of funding social care training in England and Wales, which would be through what was then called something completely different to what it's now called. So basically what they were saying is the Workforce Development Fund, which we have been working with for nearly 20 years, I think in one shape or form, was completely changing into a new way of funding social care that would be administered directly through the Department of Health. So all of those partnerships that we've been working with across the country were being dissolved on the 31st of May. Skills for Care was setting up a kind of a last only workforce development fund for 24-25, which was aimed at picking up learners who had been enrolled on, for example, a diploma this time last year, who were supposed to be finishing in this academic year. So all of that was announced. We geared up towards it. We carried on training, but started telling all of our customers that you won't be claiming this out of the Workforce Development Fund. You'll be claiming it out of a new fund that's launching early summer. Early summer came and we had a general election, which meant that everything went on hold for 6 weeks. So we had no communication from Department of Health whatsoever. Skills for Care didn't know what was going on. We didn't know what was going on. So in the best of traditions, we just carried on regardless, really. So that was taking us to just after the general election. And then we had a nightmare announcement on the 31st of July in the evening, nothing more than a simple statement by Stephen Kinnock, the Minister for Social Care, saying that the new funding through the Department of Health wasn't going ahead with the extra funding that was being planned, that they were going to still be funding social care training, but at this year's or last financial year's funding level. To which everyone went, oh my God, what on earth? How do we do this? What's going on? Myself and Peter and Dudley and loads of other people started writing a series of letters to everybody under the sun. I mean, I think we went to the BBC and Channel 4 and all the rest of it. And unfortunately, it's not like we live in times where there's not much big news. So we didn't get an awful lot of news coverage. But I was pleasantly surprised. I mean, I wrote a letter on a Thursday to the minister, and on the Friday, I'd got an appointment booked with his number 2 to talk in more detail, which was a little bit more reassuring. We had a couple of meetings. They said that, yes, they are going to continue with the funding. It would be at the same level as the 23-24 Skills for Care WDF, and that they would announce more details shortly. And finally, they have announced everything, and I can tell you what's actually happening. But please bear with me if you have detailed questions, because I don't think the Department of Health know the answers to the detailed questions yet, and I certainly don't. But this is where we are. We are now looking at a new fund called the Learning and Development Support Scheme, and it's being referenced as LDSS. It is direct Department of Health and Social Care funding, and it is paid direct to employers. It is replacing the Workforce Development Fund. It is basically replacing all of the partnerships we've been working with as well. This will be a fund that you as an individual employer access for your staff. There's no third party that you put claims through like you're probably used to doing. It funds RQF core qualifications. So that's everything from level 2 short courses through to level 5 diplomas. And there are links that you can follow with all of the details later on in the slides as well. We are looking at a funding level of around about 12 million for the 24-25 year. We are hoping, as we've been promised by government for all departments, that we will, after the budget, get to a point where we have 3-year funding allocations, which, if it happens, would be a big and positive change from what we've had over the last few years, where we've kind of lurched from year to year, not really knowing until halfway through the financial year what money we're going to be getting. It will be valid for all learners who are starting courses from the 1st of April 2024, and the current claim end date is the end of March 25. As I just said, that is probably going to change effectively, because we are expecting this scheme to carry on and carry on and carry on, and to have a clear idea of what the funding value will be year to year. There is still, for this year and this year only, a Skills for Care administered Workforce Development Fund legacy fund. So if you have learners who started a course before the 1st of April and who are finishing before the 31st of March 2025, you can still claim that through Skills for Care and the old-fashioned Workforce Development Fund. But you will have to go directly to Skills for Care to actually put in a claim. Again, there's no partnership involvement. It's a bit confusing for this year only, because it basically means we've got the tail end of one funding system dovetailing with the beginning of a brand new one. There are things which are good and things which are interesting about this new fund. You will still have to maintain your adult social care workforce data set, what used to be the NNDS, and I think most of us still think of as that. So you will still have to do that. You will still have to keep it up to date. Interestingly, there is a new thing in there, so that you can now, for qualifications, which is anything that's an RQF, claim 60% of course fees the minute a learner starts a course. So if you have new learners starting a diploma, for example, you can put in a claim for 60% of what you've paid the training provider, or 60% of the fee, the claim value up front, and then you get the remaining 40% when they finish at the end of the course. There are caveats to that. You will have to prove that you have paid the training provider in full for the claim value of that course. which means that, we'll come on to it in a bit more detail, but say, for example, sorry, if you can see something, that's my cat that won't disappear now. He loves new voices. So, for example, if you are putting on a learner on a level 3 diploma course, you can pay us what would be, or we will invoice you for what will be the claim value for that course, which at the moment is, I think it's £810. You would then, having paid me for that, be able to claim 60% of that £810 back right at the beginning of the course. So cash flow wise, for long courses, it's good news for employers. It's also good news for training providers, if I'm honest, as well. There are no restrictions, like the WDF, there are no restrictions on the nationality of your learner. They simply have to be an eligible employee, which is effectively somebody who works directly in social care, and that they are legally employed and have a UK insurance number. So how do you go about doing all of this? First off, as I said, you've got to still maintain your adult social care workforce data set account. You will still have to make sure that you have got 90% of the information they request for both your organisation and your staff force on the system, just the same as with the WDF. The big thing that you will need to do, and I don't know if anyone here has actually done it yet, is there's a link on their website which takes you through to a brief survey where you fill in information to say, yes, I want to be onboarded onto this new funding scheme. This is my core information. You fill that in, submit it. Department of Health will then have somebody who rings you and sends an email requesting further information and setting up a telephone interview to get you access to an account. I've done it myself. It's actually relatively straightforward. And you do leave that phone call with an account number that's verified so that you can, from that moment on, go straight in and put claims in. It's administered by the NHS. It's the same people who administer and have been for years the way that NHS claims funding back for training that they've done. So whilst it's new to us, the actual administration of it is something that's tried and tested. And anecdotally, I'm hearing that claims money comes back pretty quickly, which, no offence to Skills for Care, but that could take quite a while. Going through partnerships, because some partnerships were great, some partnerships would wait until 4 months time and they'd got a deadline coming up and a whole load of claims built up. So this one should be quicker in terms of paying you when you put in a claim. In terms of once you've done that and you're registered with the Department of Health, LDSS, and you have your account number, it's simply a case of choosing a course, paying the learning provider, training and claiming. And remember that for RQF qualifications, you can actually claim 60% of that claim value at the start. There is a thing in there that says that if, for example, a learner starts a course, attends all of the sessions, but for some reason doesn't finally complete, that you can still claim that remaining 40%. This is where it gets a little bit unclear on what the Department of Health do and don't know, in that I asked them for clarification on this, and all they said to me was all the employer would need is an email or a letter from the training provider to say that this learner had completed but not passed the course. That, I think, is something they'll probably reconsider as time goes on, but at the moment, that's what they're saying. So as an employer, you have a large degree more confidence that if you enroll somebody on a diploma, you won't be out of pocket even if they wander off and don't finish. If you remember with Skills for Care, you could only claim when somebody finished a course. So you would be waiting for say, a level 3 diploma, you'd be waiting at least a year after your initial investment before you got any money back. So this does improve that quite considerably. The big thing to remember, and I mean, I must point out, this is not me just saying this is a learning provider, is that in the past with Workforce Development Fund, people were used to a learner completing a course, then them getting the funding from WDF, then them paying the learning provider. With this new fund, it's not that way around. It is that you have to pay the learning provider first and get a receipt from them to say that you've paid in order to claim. So this will be a slightly different way of doing it. In the past, people like ourselves have borne the cash flow risk, waiting for people to pay us when they get their claims. From now on, it's going to be employers who are bearing the cash flow risk in terms of paying learning provider and then getting the money back. And as I said, don't forget, you'll still need to do all of the ASC WDF staff records business. You'll still have to get 90% of the data completed to be eligible to claim. In terms of eligible courses, they are the same as was funded through Skills for Care last year, with some additions, and they are adding courses as and when they see fit. They added a couple, for example, on Monday, and they have assured me that they're not taking off any courses. So there's a link here that will take you straight through to the courses that are funded, and they are dividing them into training courses and qualifications. Qualifications are basically anything that's an RQF or NVQ if you're a bit older like me. Training courses are things like the Skills for Care, Lead to Succeed course and stuff like that. If you are, now I should point out that other training providers are available, but with us, if you want to put people on courses, it's simply a matter of letting us know who you want to enroll. And we need very little information. We need their name, their email address, telephone number. We will then send people out online registration forms, etc., etc. We ask that you tell us who you want copied into all the communications we have with that learner so that you know what's going on, that you understand the commitment that the learner and you make in terms of support. We then send out all the enrollment links. The big difference again is at the end of a course, when a learner completes, we invoice you for the claim value if it's a short course. So something like a level 2 medication course. We send you all the information that we can supply that you will need to claim. You will need to pay us at the same time so that we can send you a paid receipt so that you can claim. And that really is the big difference. In terms of our courses, and I'd be foolish if I didn't sit here and tell you what we do. Our big course is weekly. We do a training course which runs over 4 days, and that's all virtual training for new staff. We put people through the level 2 medication RQF, which is done on the Thursday and Friday, and then we do a non-RQF version of the care certificate on the Monday, Tuesday. So at the end of the course, your learners have done a national qualification on medication and administering, and they have done our in-house qualification, our in-house course, which is the old-fashioned care certificate. Please note that we don't do the basic life support as part of that care certificate. People normally do that in-house. Any more information you want on that, just feel free to ask. And we do that every week. So we've put thousands of people through this since 2020. And it's Zoom in the morning. In the afternoon, people have homework to do. They have telephone and email access to the tutor for extra support. For managers, we do, as an endorsed provider from Skills for Care, we do all of the management courses pretty much that they offer. So that's things like the Well-Led course, Lead to Succeed, and then a whole load of single session CPD modules, which are run over half a day Zoom on understanding self-management, performance management, and workforce culture. And again, they are all fully funded through the new LDSS. So we only invoice you for the amount that you are claiming from them. So it's free, for want of a better description. We also do this with a level 2 certificate in autistic spectrum conditions and for the level 2 award in awareness of dementia. And again, all of these slides will be circulated up on the website as well after the session. For diplomas, one thing to bear in mind is the new learning, the new LDSS does not fund level 2 diplomas. Level 2 diplomas are all being subject to a big Ofqual re-evaluation at the moment, and that is affecting us as well as other sectors. So if you have somebody on a level 2 diploma at the moment, you need to make sure that they finish before the 31st of March next year, so that you can still claim their funding back from Skills for Care Legacy Fund, you know, the dual WDF one that's still running over this year only. For level 3 and level 5, it's all through the LDSS now for all new learners. There is a brand new level 2 award in adult social care that has come out. This is funded to a high level by the new LDSS. So, for example, at the moment, a level 3 diploma, the claim value is only £800. For this new level 2 award in adult social care, which is basically, oh God, great big typo up there that I missed earlier. But that is basically a new course which follows the care certificate standards. It is funded at £1,500 per learner. So I'm expecting that it will be a very popular course for us and a very popular course for employers. It is not designed for brand new staff. Ideally, it's for staff who they've probably been with you about 6 to 9 months. So they're people who you've already inducted, they've already done their, you know, non-accredited care certificate and all of their other training, you know, manual handling type stuff, and who you are happy to have with you, and you are happy to invest in the same way that you probably would have done a level 2 diploma member of staff. We are looking at running this with 4 Zoom sessions, which we will hold once a month. Each of those sessions will probably only be 2 to 3 hours. Remote support from the assessor, and 3 to 4 observations towards the middle of the course. If you're interested in that, do let us know. It's a brand new one. We are just about to start delivering it. As an offshoot to that, it is obviously, because of the popularity of this new course, there will be more demand than there are assessors available in the country. And it's part of the research that the Department of Health did, in that there are not enough currently RQF assessors to do all of the observations that will be needed if this course gets a lot of demand. So what we're doing, and I suspect other learning providers will be doing as well, is saying to our customers, do you have 1 or 2 members of staff who would be interested in doing the level 3 award in training and education? And this will be delivered by us, again, largely remotely, but some of it will have to be observations. Again, it's fully funded. There's no employer contribution, but it will mean that if you then have a whole load of people doing the level 2 care certificate, for want of a better description, the Adult Social Care Award, you will be able to assess those people with your own staff through us as a centre in-house. Now, all of the important links, they are divided into 3. There's the top one, which is basically telling you everything in general about the fund and how you claim and what eligibility criteria they are. There is the link for getting actually signed up to the fund, and there is the list of eligible training courses. as I say, all of this is very new, and I am expecting that if you are interested in using this fund, get logged in as quickly as possible so that you can be onboarded. And I hate the fact the Department of Health are having to make me use a word that doesn't exist, like onboarded, but that's what they're saying. And that will get you set up with an account where you can claim. Obviously, there are going to be so many questions about how all of this works. So please feel free to call or email or set up a Zoom meeting and we can talk a lot more. But this will be the new way of claiming and training funding, probably for the next few years. It looks like it's here to stay.
Thank you for that, John. That was really impactful, and and I think we've learned a lot. Some people have been asking before we go ahead and ask you the questions in the chat, whether it would be able to provide some of the links or your contact details in the chat itself directly, because that might be helpful. So whilst you're doing that, I will address one or two of the questions here. So the first question, whilst you're trying to put things away, is can we get funding for international recruits?
As long as they are legally employed, have a UK national insurance number.
I hope that was easy enough. Someone has also added in, some of our contracts require.
Sorry,
Sorry.
I just wanted to ask a question, Dudley, on top of what you just asked.
Go ahead.
You said, while as far as they are in the UK, for how long? Is there a duration? Because I know some people actually request for a maximum number of years or months that you should have been in the UK before you can enroll.
Not as far as we know. It was one of the questions that was raised. Peter, you were at a big boy meeting about this, so correct me if I'm wrong. But as far as I know, there is no nationality criteria at all. It is simply that they are employed in an eligible care post, that they have a UK national insurance number.
Yeah, that is my understanding as well.
I mean, to make sense of this, it's really the money's going to the employer who will support his members of staff. So as long as you're a member of staff and you have an NI and you've just come in, if they choose that they want you to be funded under this, then you'll fall into it, as opposed to it being by the individual. It's the provider. That's why it's important to follow the process, register as John said, but also follow the procedure of getting yourself signed up in the right way. So if you are
sorry, there are two
ahead.
things that have struck me that I didn't mention in the presentation that are important. One of which is there will be, under this scheme going forward, you will not be able to claim for apprentice learners anymore. Apprentice learners are funded through Skills Funding Agency. In the past, you could also claim money from Skills for Care for them in terms of backfill costs and stuff. That has ended or will end when the WDF ends next year. So under this new scheme, if you've got apprenticeship learners, you won't be able to claim any funding for them. You will simply have their training paid for via the learning provider and their claims to the Skills Funding Agency.
There was half a question popped up in the chat, and I think, trying to make it a whole question, I think what the question was some of our contracts require a full qualification, rather, so not completing a qualification is not acceptable. I mean, most local authorities, as far as I have seen, have not been actually checking the qualifications of staff. CQC will do that, and I have to say that there have been quite a lot of fake certificates about, and there is also concern over some very poor quality training in the sector. There's no point going into the details of it here, but as the CQC inspections roll out, you will be aware that they are asking more questions of more of your staff. So they are expecting to be able to get evidence of the staff having been trained, and they will ask the staff which training they've had, who did it, and then they will ask them questions about that training. And the staff should be able to evidence that they've been on the training and that they have gained something. And the key question is, what is the benefit to the service user or to the client?
In
I think
terms of this whole non-completion stuff, if I'm honest, I see that it is helpful for employers. I mean, from our point of view, on a diploma, for example, we have very few learners who start and don't finish. Generally, even if they move employer, we will try and get them finished in their new, because they normally move to a different care employer. So we will normally try and get them finished. From our point of view, if you're the employer that's paid all of their fees, you're the one that we will send the claims info to, so that even if you've had somebody for 6 months, they've moved to another employer and finished their course, we would be sending you all of the information you need to claim. And this is what the LDSS are saying they prefer as practice as well. I think the whole thing about being able to claim, even if you've not been certificated, I personally find a little bit odd. And I suspect Department of Health will reconsider that over time, because I suspect they will get an awful lot of bogus claims going in. But it does give you a little bit of financial security. If, for example, you have a learner who's on a course, 2 weeks before they complete, they move to a different employer and it's not in care, they don't want to carry on, at least you know that you can claim that money back, because we will be able to hand on heart say, yes, they've done all of the training that was required, they just haven't submitted a final portfolio for assessment. So I wouldn't get too hung up on that. I would be surprised if Department of Health don't rethink that over time, because, I mean, I hate to say it as a learning provider, but there are lots and lots of dodgy people out there who will probably quite happily give you the evidence to put in dodgy claims, and Department of Health will pick that up pretty quickly, I suspect.
Another quick question on what your point, John, is that sometimes people will get a carer that comes from another work environment. They may have done 75% of this and then they come to them. So what would you suggest should happen?
How do you mean? Sorry.
So if someone's may have worked in a certain care home, for example, and they were going through the course under the care home in doing, say, for example, the care certificate, then they leave, then they go to care home number 2.
Yeah.
Is it transferable, and what can that care worker do would be the question.
The only things that personally I would feel confident in thinking of as transferable would be an RQF qualification, because you know that's to a national standard, and if they've got the certificate to that, yes, training providers vary, but they will have covered the material in that course. If somebody is coming to you with a care certificate, and we get presented with quite iffy looking ones from time to time, my personal preference would be, as a new employer, I would want to know that all of my staff are coming from the same baseline. So even if somebody has got a non-regulated qualification, say they've got, you know, like the one that we're all used to, not the level 2 new care certificate thing, but if they're coming to you and they're showing you a care certificate from another company, I would personally want to put them through my own training as an employer, just to make sure that they are on the same page as everyone else who we employ.
And the final question for me, because I know people probably may want to ask another question: how many claims can you make as a provider for an individual, which is the other question, John?
For an individual, I can't see anywhere that they have set an individual level. Skills for Care always used to say that you could only claim, I think it was £1,600 a year. I haven't seen that on the LDSS site. It might be hidden away. What I do know is that in many ways, I mean, there are lots of good things about working with partnerships, but there are also problems in that partnerships would suddenly turn around towards the end of a financial year and say, oh, you've had more than your original allocation, I can't take any more claims. And people would be left in the lurch until they could put in a claim out of next year's funding. And that used to happen quite regularly. With this new LDSS, the good news is the maximum claim value for any employer, and that includes if they've got multiple registered sites, is 400,000. So I don't think many employers are going to have to worry about putting in claims for too much money. Also, it's worth noting that because they're not paying for apprenticeships and because the level 2 diploma has been taken out, there will probably be more than enough money to meet demand as used to have from Skills for Care. I was talking to my contact at Skills for Care National, and they were saying they've actually never had an issue of having more claims than they have been allocated funding for from the Department of Health for any given financial year. The problem usually came with where an individual partnership ran out of money. So I think going forward, you're going to have a lot more financial security in putting claims in, even though they say, you know, it's first come, first served and all the rest of it. They have put a figure of 400,000 per employer.
Thank you. I think that 400,000 is enough for all the.
I think that is probably enough for virtually everyone.
Okay, thank you, John. I know we're running short of time because we've got about 10 minutes left. John, if you can put your information in the chat if you haven't already.
Put my email address in there, which is the best way, really.
Yeah, and you can contact John or you can contact Peter or myself. We work with John, and I know there'll be a lot more questions that you may want to ask. So please send any questions through. That'd be really helpful as well in regards to that. Okay, Peter, go ahead.
If I can I just go back to the questions that were asked earlier, which I've pulled out of the chat here. There's one question I'm not entirely clear. Basically the question is, with many male care staff, what is the law regarding providing them with work? Now, that depends. If you're a dom care operator and they are, if you like, locally employed staff, they're probably going to be on 0 hours. So you're not guaranteeing them hours. If they're, say, international or sponsored recruits and you are guaranteeing them an amount of pay, then you are guaranteeing them that amount of pay, even if you don't have work for them. So in that sense, don't take on people that you haven't got work for. But there is no law, as far as I'm aware, that you have to provide people with work if they're on 0 hours. If you want to expound on the question, we'll go forward.
I think there's a question of, obviously, we have to understand as well, we're talking about employment law, we're talking about discrimination as well. So you have to be very careful and you're going down this road. I think there has been a question where, for example, a client or a service user may require a female member of staff, and that's preference, and that's slightly different. So you have to bear in mind that the work that a male may receive may be down to preference as to legally whether they have the right to work or not. So make sure you don't confuse that, and it can be an area where you have to be mindful for as well with any client.
Yeah, and if you subscribe to someone like Citation, they will be able to tell you what's what, or you can use LCaS, who will again give you advice. Their helpline is very, very helpful. We've got a couple of other questions. How do you deal with a service user who is racist and keeps making false allegations against carers to the local authority? This has come up previously, and the care provider was actually able to evidence the racist claims. In one case, the carer or carers made notes of what was said to them and who actually said it, because it was not necessarily the service user, it was service users, visitors or friends that made the racist comments. There was also, we've seen a similar thing with bullying of carers. And I think there's been a question about body-worn cameras in this situation. But I would take it up. Dudley may have some additional points, but I would take it up directly with the local authority, because again, some of these people who cause the problems get passed on from one carer to another, and the local authority don't actually take responsibility for sorting it out. Dudley.
I mean, just to add on to it, I think the first port of call is to take evidence, note and document it as well, but also as well address the actual people who have been on the end of receiving end of it, because CQC will also look into that as well. If your staff member feels it wasn't addressed within your organization, that's also another issue that you don't want to be involved with. But on the first hand, take the information. If it's false allegations, then it's something that it can be raised. And depending on speaking to whoever's giving you the contract, if it's private work, then maybe you address it, as Peter mentioned, with LCaS or as well. What we've seen in the riots is that now there is a no tolerance now on things such as language, discrimination, abuse as well. So actually you can report it to the police as well, if you feel it's necessary with the right evidence as well. So it's not just LCaS, it's about actually it's actually seen as something which you can report to the police as well. So I do bear
You
that
can
in.
also report it to safeguarding, because
Yeah,
you are responsible for the safeguarding of your staff as well as the safeguarding of clients or service users. So, and depending on, you know, if there are international recruits, if there's evidence of bullying, then you can also look at organisations like Unseen, for example. We're a healthcare training company, and we've had to retrain many overseas staff. We've over 200 workers, and they are now struggling to get work. My question is, what is the reason why people are not hiring them? Well, there's 2 or 3 reasons here. I had some information come through this morning earlier than the meeting started, and the estimation is that there are 6,000 people in the London area who are on license, they're international recruits who do not have work. Now, I think, and Dudley may agree with this, that is a high estimate. It's probably somewhere between 3,000 and 4,000. However, many people have been duped into coming to the UK for social care work. The company that brought them in has no work for them. The Home Office, in my personal view, have been guilty of issuing far too many licenses, and issuing licenses to organisations which they say they will not do, such as dom care organisations who do not have contracts, who cannot guarantee hours. And the reason that people are not hiring them, if you talk to local authorities, you will find that they have capacity. They do not need more dom care providers. That's the key area. So there is actually not a need for staff. Now, we are seeing international and sponsored recruits moving around the country to find work. But like many of them may be younger, they don't want to actually work in areas where there's no life. They don't want to work in say rural areas. They want to be in conurbations like London. Possibly they think the streets are paved with gold. Dudley?
yeah, I like the notion of gold. One thing I would say is that I'm finding that with providers, some of them have been obviously scared off of the Home Office and revocations that have taken place. There are some that are sitting on their cause of licenses as well and not sure what to do. One thing I would say is that there is a massive pool of potential workers who are not employed. Really, where you can get in touch, they've got this organization that's there in seeing the quality of staff, give them interviews, potentially you get to train them up using whether it's the likes of John Buttle or other sort of training organizations, so you get them up to a certain standard. It's not the 10s and 50s that people are trying to bring people through the door, but I also understand it's the 1s and 2s. the international workforce haven't changed. They were the same as they were when people were jumping to hire them. So they are a good workforce. It's just being trained. And I also know as well, there is a struggle to bring homegrown talent into the working environment. Those maybe under 25 or those maybe who may be on benefits, bring them in, or apprentices. I know that people have complained. So actually, the international recruits are a good workforce, but I think it also bears down with training, giving I would say it's not just about, it's give everyone an opportunity, whether they're, it's your recruitment policy that's important, and they are make up part and parcel of it as well. So do utilize it. And one thing that we were going to share is that now local authorities now are potentially having a letter to actually to fast track COS licenses. So you won't have to wait the long periods of time that you were before. So you probably have to get in touch with your local authorities to be able to find out. They'll be able to produce a letter. They're acting almost like agencies now as well.
Can I add something to this, please?
Sure.
On train. So we tried taking on sponsored workers under our recruitment because we thought, they would be trained and everything. First month after we received a letter from HMRC that we are the main and the first employer, that goes to show, and this is for other agencies as well, that they did not work for last 6 or 9 months. And just to kind of safeguard, we had to now asking everybody to produce their last 6 months pay slip, because we are not the main employer. We put in that we are the secondary employer. However, the HMRC sent the different code saying you are the main employer. So there are many more complications within that. It's not as simple as just go and hire. We want to, but we can't due to all of those other requirements. Thank you.
I think back to the point, what we have found with the Home Office UKVI inspections or visits is that they are very much stricter than, say, CQC or local authorities. They do not have grey areas, and we've got, as I say, we've got a number of events coming up for South East London and North Central London, where we actually have the Home Office in attendance so people can ask questions. The Home Office process seems to have changed as we've gone along, but they are very much evidence-based. And we have seen, or it has been seen, that quite a lot of international recruits have not been adequately paid. And again, if you were the employer taking, say, the 20 hours, employers have been advised to get exactly right what they are taking on, and to make sure that the paperwork is absolutely correct before they get involved in anything. And Dudley may have something to add to that, but dealing with the Home Office UKVI can be complicated because actually getting in touch with them is not easy. Getting them to respond to stuff also is not necessarily easy or swift, by which time the problem could have become exacerbated.
I mean, one thing I would add, Peter, is I think international recruitment was something which was really fun and joyful in the beginning. I think it's about, if you do take on anyone, as you would with anyone that's homegrown, have as much evidence as possible. Potentially, if you're not sure, either contact a lawyer or have things, or a certain group professional body that will help you with the paperwork. There's things like citation and other bodies as well. Do not do it alone, because at the end of the day, the Home Office or UKVI are the ones who are going to be questioning you, and that's not what you want. Yes, people, if someone in the chat has mentioned as well, the problem as well where you've got with a lot of these Comcare providers is that a lot of them, their hours or their sort of contracts have not been honoured, and so the amount of hours they had initially have been downsized, means that they then can't support and supply the workforce with hours, which is another sort of issue that seems to be occurring. So before you do employ others, individuals, do really look at your hours. But I know a lot of people are using and utilizing the 20 hours individuals, which is another way potentially how you look at it, of actually seeing if someone has got the skill set, and if people have seen that the 20 hours have been quite they've done well in those sort of hours that they've used, then they potentially then take them on full time. So it's an area which is developing. We're trying to speak. I'm speaking to the head nurse potentially at some point, and we try and see, we're speaking to Home Office of what can be done. I think it's the workforce is, there is always a shortfall in the workforce in social care, and so it has to be filled in some shape or form. I think it's about how it's sort of navigated and the way it's done. But I think it's to be continued. I think this is not a subject that's going to end overnight. But if you do need workforce, by all means, please, by all means, or access to it, get in touch if you're not sure of any questions. We can support and help you as well.
I think it's true to say that the cost, some organizations have seen international recruits as a cheap route to getting hold of staff that they can control and make sure that those staff work, whatever it is, 50 hours a week. A, it's not cheap, and B, you can't do that to staff. Staff are covered when they get to the UK and have a license and pay national insurance. They are governed by exactly the same rules of engagement as UK staff. And we've had a couple of other points. That just one of the someone made the very valid point that the issue with tribunal claims leading to costly payouts is that some employers do not understand the Equality Act of 2010. We would say that many employers do not understand the basic business tenets of running a business. And if you get involved with the Home Office or UKVI checks, they will triangulate with the HMRC around payments. So the evidence that they can bring to bear on an inspection of your organization is deep. There's an awful lot of it, and it's quite overbearing, frankly. And they take away licenses, and in theory, if a license is revoked, it cannot be got back. You've actually got a very short window of time to prove that their evidence is wrong. And there's one from Patricia here. Can only employ people for the 20 hours if there's proof that they are doing the full hours at their sponsored employment. If you're the one, Dudley will correct me here, but if you're the one doing the 20 hours of employment, you don't need a COS license to do that. And you don't, it's not you that needs to prove that they're doing the full hours elsewhere. You just need to prove what you're funding them for and what you're paying them for.
I mean, I would add into this bit, I think I agree this. You're going to hear lots of 20 hours, lots of individuals being hired, especially those 3,000 to 6,000 they're here, especially if we're talking about London, being hired by different organizations, and people are utilizing them. I would say just keep a note of what you're doing, and a lot of providers I know are using them almost as their sort of backup staff. So do bear that in mind. Going back on another point you just raised, and John Buttle's here as well, and I'm not going to plug him, but we're talking about organizations being well led. I think it's probably one of the biggest areas for especially small providers, and when it comes to their CQC inspections, about being well led. Being well led means understanding your compliance, HR, just knowing the business as a whole and having things in place. So it's really helpful if you are looking at that, definitely on a leadership front. It's really helpful to put that in place. And I would turn around and say John would probably concur as well around that. I know we're running short of time.
Yeah.
It seems there is a few questions in here, which probably have to revisit in regards to tenders, hours, contracts, losing hours as a whole. And I think there is probably another session that we will have to put together. And this is probably one of the points we want to raise today of areas that you as providers want us to cover. As LCaS, we are really growing as an organization, but we also, in growing as an organization, our capacity to be able to manage anything is not as easy as it once was. So we're actually looking to expand more locally in the different areas that we're in, and potentially to have a board, but also the topics that we provide across the whole year, of what areas that you would like us to cover as well, because we may be speaking to local authorities, someone in the government, CQC. So we're also providing and finding out of what the providers are saying, but also you can play a hand in that as well. So the capacity is important. We are looking at potentially putting a board, advisory board together, which we would potentially ask those if they want to apply. It's nothing too daunting, don't worry about it, where you actually just come together to help steer some of the things that are taking place within the sector. But we're looking from a locality point of view, which means in numbers, you're able to hear the voices of those maybe locally. We're able to share that with either CQC, local authorities, and even as John said, speak to him. He'll speak to things such as the health minister as well. So I think it's really important that this space, but also you as well, are more valuable than you think. We've got surveys that come out across quite openly as well. So it's something that we're going to be sharing to get your feedback, probably with a set of questions that you can feed us back on as well. Peter, I'm not sure if you want to add anything to that as well.
Yes, thank you, Dudley. That's very well put. There's a couple of questions here that I think just in the chat, just to briefly touch on before we go. The one from Campus Lodge, if you've got a member of staff that needs a sponsor, if you want to extend your COS license, your local DAS, if you've got work for them and you can prove you've got work for them, your local DAS should sign off that application. And that would actually, we have seen COS licenses issued in 3 days, less than 3 days, which is pretty remarkable. And there's a long pointed piece here from Hawa Kamara. New providers are struggling to find clients or tenders. This is back to the fact that, being bluntly honest, there are too many dom care providers and not enough work. And many dom care providers are opening up, having got no market research done. They are opening in areas where the local authorities have got a contract set up for several years that they're not going to budge on. They've already got a list of providers, and they won't let new people in. The issue with CQC is that if you get registered, which is actually of benefit to CQC because it gets them a pile of money, their income is going up. The more dom care providers there are, the bigger their income. You get registered, but you don't get inspected. We've had some organisations that have been waiting a couple of years to get inspected. We've raised this, local DAS, that's the local Director of Adult Social Services. So your contact at the local authority should be able to put you in touch with who that director is. And the ability of the DAS to sign it off is universal, but some local authority DASs are signing papers, some are not. And there's, I'm afraid, nothing we LCaS can do about that. But just coming back to the point about capacity in social care, if you are inspected by CQC, you are not necessarily, and probably now, if you're new, you're not going to get a rating, you know, good, indifferent, whatever, because they want history, and they also want a reasonable number of clients. Now, what that number of clients is difficult to ascertain. We've seen people with 4 clients get a rating. We've seen people with 10 not get a rating. Again, it's a question we're trying to get a definite answer to. But
there was, sorry, go on, Peter, sorry.
there are about 30 quality standards, and at the moment on an inspection, CQC are doing about 12 or 13 of those, and that is not considered enough to change a rating or to give a new rating. And the priorities that we gather have changed because some organizations haven't been inspected for up to 8 years. Now, we're aware of local providers who haven't been inspected for over 5 years. A lot changes in 5 years. Managers change, staff change. They've got a backlog. The rumor that CQC are losing staff is not true, but their inspectors are, in that sense, they are struggling with their own new system. Dudley.
No. I mean, I agree with you. Just on the point of pay, there was a question that someone wanted to ask. I know we're almost running out of time, but someone has said that they'd actually filled their PIR returns and they haven't received confirmation or received a bill from CQC to pay the annual fees for total service users. I'm not sure if anyone has also experienced not getting a bill. And I mean, I probably wouldn't say anything myself personally, very honest individuals. But if anyone has experienced not being invoiced from CQC or it's taken a length of time, I'm not sure if anyone's probably going to be brave enough to probably raise their hand, but you can use the WhatsApp group or send Peter and I a message. A few individuals are probably a bit scratch of the head and probably blaming it on the new IT system not working. But I don't know about CQC not charging people, maybe not inspecting people, maybe, but it's a new one. So it sounds like one of those things we'll see, as Peter says, the Daily Fail newspaper that you hear from. But but outside of that, I think the most important going forward is that we'll be meeting again next month, but in between that, we'll probably be posting some questions around what you would like to see from LCaS, and also as well as we go forward, actually how more involved some providers or individuals would like to be involved with LCaS as well, and that may be the case.
And someone has just put a comment in that we've not received a bill for the past 4 years. If I were you, I would put the money in a side account and be prepared to pay it at short notice, because the government departments may take time, but they rarely forget. And sometimes when they forget, they're kind enough to charge you interest because you haven't volunteered to pay them. And if you do volunteer to pay them, it can be very difficult to get them to accept the money. But you need to evidence that you've done it. And they may have not invoiced you for 4 years, but when they do invoice you, they won't give you 4 years more to pay. They'll expect it in something like 4 weeks. But the next meeting in October on the 23rd, we will have Mick Feather with us from Citation, and so the meeting will be about CQC.
He's an ex-CQC inspector, if anyone isn't aware, and he goes through every inspection report possible. So probably there'll be lots of questions that you may want to bring beforehand, and he will probably have lots of answers going forward, especially after what's gone on with CQC. And if anyone wants to apply for a new job, they are looking for a new head of CQC, if anyone's brave enough as well. And I'm sure you can invoice them for that as well. And
we'll also probably have John back, and so we can update the training situation. But just to touch on ASC, when we have things like MPOX mentioned, there is talk that they're going to start asking providers more questions about preparations, etc. Do keep ICP absolutely up to date. we've put the UK HSA update in the chat. We'll circulate it anyway, but they are looking to extend the tracker. The tracker will be used as the base, so you may well find that more questions are added to the tracker. They won't give you any pay for the time it takes to fill the tracker in, but it will be a requirement. And it wouldn't surprise me, or I think John or Dudley, if at some time ASC is made compulsory.
Sorry, what tracker was that you were mentioning just now? We were just having a brief little discussion about a few other things.
Capacity tracker.
Okay, yeah, the capacity tracker that pops up every other month or every other day. Yes.
Yes. Yeah. Okay.
Well, thank you very much. I think we've slightly gone over, but it seems that with the amount of time off, there seems to have been a lot more information that has been shared. If you have any queries, I said we've put our information in the chat. Do send any further questions, and we will try and work through it. Remember, Peter is meeting with CQC this month, so if you do want to get any questions in there, please send us any questions, any topics, Peter, that they have specifically inquired about, or is this any general questions that you may want to ask?
I think one of the things that is coming through from national conversations is around the CQC overviews of local authorities and the interaction between local authorities and their adult social care providers prior to CQC coming into the overview inspection, because it seems in many areas the local authorities are simply not talking to providers. They think they know what providers need. Simple as that. Anyway, thank you very much for your time. Thanks to John, Dudley, and thank you all for your time. And I will go through the chat. I'll pick up all the contacts in there. I may come back to some of you for more information. If we don't have your up-to-date email addresses, please let us have them by email or by text, whatever. And we look forward to seeing you on the 23rd of November. October. 23rd of November, I won't be in the country. Thank you very much, Dudley.
Thank you very much. And everyone, do have a great rest of the month till we see you next. Please also as well, there's lots of events taking place. I know there's a lot of information being shared, and you're all very busy. So I also as well, Skills for Care will tell you they've got a deputy managers meetings that they have. So actually get potentially a good number who also may be able to get the information. Just because you're busy, it's always good to maybe send someone else, and that can be also part of helping them. Someone with CPD to show in that they're actually going to these events, speaking, listening, and bringing back information which you can all pick up as well.
Brilliant. Thank you very much.
Thank you.
Have a good day.
Thank you.
Take care.
All the best.
Bye. Have a good day.